A hearty good evening and welcome to the session on role of hystero-laparoscopy in conceiving. We are glad to have Dr. Suyash among us today to help us understand the topic. We will take us through that and more in this session today. So before we dive into this session, Doctor, as you know, Cryopreservation Awareness Month is on. And I would like to ask you one question about what are your views on sperm freezing?
Yeah, I first of all, a very good evening to every one of you. I would suggest semen freezing is like a very wise decision and can be made as a freedom thing for guys as well. So we all know about egg freezing, and there is social egg freezing, there is some therapeutic egg freezing that is going on. But yes, for guys also, especially if you want to delay your fertility or if you're planning a vasectomy for that matter, or in case if you are unfortunately diagnosed with some blood cancer or you are needing some sort of chemotherapy, radiation therapy, prior to any sort of treatment, do your sperm freezing. That is going to help you in your future conceiving. So it's a very widely used option and a very wise option and readily available, I will say, and it's a cheap option for guys as well.
Okay, thank you so much for sharing this information with us. We can now start with the session. Doctor, you have the stage.
Yeah, thank you. So let me introduce once again. I am Dr. Suyash. I am a fertility consultant and laparoscopic surgeon at Apollo Fertility Center, Thane. So today we'll be talking about role of hysterolaparoscopy in conceiving. So what do you mean by hysterolaparoscopy? So basically it is a surgery. It's a daycare surgery. It has two parts into it. It's a hysteroscopy and a laparoscopy. So hysteroscopy is like we'll be evaluating the uterus completely from inside, and a laparoscopy is we are going to evaluate the uterus from outside, the tubes, ovaries, your overall pelvic organ completely in toto. So this is hysterolaparoscopy. सो हम आम इसमें बोलते हैं कि इसे लेजर का ऑपरेशन बोलते हैं, बट इट इज नॉट अ लेजर ऑपरेशन, इट्स अ लैप्रोस्कोपी. So when does your fertility consultant dictates you कि yes you may need a laparoscopic surgery? So there are multiple reasons behind which you can go for a like hystero or a laparoscopy, or you can combine both of them together. So, for example, if you have an ovarian cyst, if it is a hemorrhagic ovarian cyst or a simple cyst that is more than 5-6 centimeters, if you have a dermoid cyst, if you have endometriosis or a chocolate cyst that we commonly called it as, so in that case, yes, you need to remove that pathology. So you can remove it via a laparoscope, or you can remove it with the open surgery. So open surgery is nowadays outdated. We usually do not prefer going ahead with the open surgery because that requires a lot of tissue handling and its own complication. So a normal laparoscopic surgery is like very minimally invasive. We can operate and discharge you in the very same day. There is minimal or hardly any blood loss. The anesthesia required is very less, and plus the comfort of the patient is very good. So as I mentioned, if I operate you in the morning, I can send you back in the evening itself or maybe at night. So it is a daycare procedure. So as I mentioned, if it is like an ovarian tissue that is a problem, like a cyst, endometriosis, or a dermoid, you may need a laparoscopic surgery. In case if your tubes are blocked, if you've done a HSG or SSG, which is showing a left tubal block or bilateral tubal block, so you need to remove that blockage, right? So for that also we have to go with the hystolaparoscopy. Or in case if you have a hydrosalpinx, that is fluid accumulated inside your tubes, in that case also you need declipping or you have to repair the tube. So for that also you need a hystolaparoscopy. Third is a uterine problems. Like if you have a big fibroid which is sitting on your uterus, if it may be a subserosal one, it could be an intramural one, or it could be a submucosal one. So if it is like a submucosal, that is the fibroid is extending inside the uterine cavity, you may need a hysteroscopic approach as well. If it is an outside fibroid, yes, we can deal it with a hysteroscopic one. If you have adenomyosis, if you have multiple abortions, and if your 3D 4D scan show you that there are adhesions inside your uterine cavity, in that case also you may need a hysteroscopy plus a laparoscopy. Sometimes it is only that unexplained sort of infertility where we want to go ahead for a tubal check and overall check of your pelvic anatomy. So Hysterolaparoscopy is a gold standard. It is going to give me a perfect view, a perfect, complete visualization of your pelvic anatomy. It is going to make my decisions clear about how to go ahead, what would be the next plan of action. So we have multiple patients who have done plenty of cycles with OI cycles, ovulation induction cycles, maybe one or two cycles of IUI also, but they're not conceiving. So there should be some reason behind it why they are not conceiving. The other parameters are absolutely normal. So in that case also, whenever it is like an unexplained sort of infertility, there also we do recommend you going ahead with the hysterolaparoscopic evaluation completely. There's one more set of patients where you need only a hysteroscopy, and that too without any pathological cause. For example, if you have when you're planning a embryo transfer, like a IVF procedure, see, your uterus is the only major organ to me which is going to give me a pregnancy, and it is going to hold the pregnancy for good 9 months. So I want the uterus to be like a good sized cavity and a strong one which is going to keep the pregnancy safe for the entire 9 months. So prior to IVF cycles, or especially if you have a failed IVF cycle, in that case also we have to evaluate what has gone wrong. So in that case also we have to do a hysteroscopy just to see whether the uterine cavity is good enough. And especially if you have multiple abortions, especially the DNCs, the क्यूरेटाज जो बोलते थे थैली सफाई करना, तो अगर आपका बहुत सारा 2 बार 3 बार हुआ है, then also there is a possibility there might be some smaller adhesions which could be inside your uterine cavity near the ostia, near the tubal end, which may be a reason for your infertility. For that cases also we suggest you going ahead with the hysteroscopic evaluation. So now let's talk about the procedure in detail. So basically, as I mentioned, it's a surgery. It is going to require you anesthesia. So the type of anesthesia what we recommend is maybe you can operate under general anesthesia, or if your surgeon is comfortable, you can go ahead with the spinal anesthesia with the sedation. So that is going that it depends completely upon the anesthetist and the surgeon comfortness. So once the anesthesia is given, what we usually do is going ahead with a hysteroscopy. So basically, a very small telescope. It's a small camera. It's a 2.9 millimeter camera that goes inside your vagina, the cervix, and it is going to evaluate your uterine cavity in toto. So there won't be any cut, no stitches over your private part. So whatever is going to happen to that 2.9 millimeter telescope. So we evaluate the entire cavity in case there is some polyp, if there is some adhesion, some septum inside, we are going to correct it in the very same setting. So that is the advantage of doing a hysterolaparoscopy together, because it is like a diagnostic and a corrective procedure in one setting completely. Second is a laparoscopy. So in laparoscopy, so as I mentioned, hysteroscopy, the telescope is going to go through a natural opening. But in laparoscopy, we do not have any opening on the abdomen, right? So we have to create openings. So those are called as ports. So maybe we can use only 5 millimeter ports. We can use 2 or maximum 3 ports through which we need, if you need an operative intervention, so we can do that. So that is going to evaluate your uterus, the tubes, the ovaries, the overall anatomical relation with other organs. There might be some endometriotic components. If you are into a PCOD range, if your PCOD is very, very high, if you need an PCO drilling, so that can be done in the same setting. If you have lots of adhesions between your intestine and the uterus, the ovaries, that can be corrected. So multiple things can be done through your laparoscopic thing. So once the procedure is done, it usually takes like around 1 hour, 1.5 hours at the max if you need some correction. Otherwise, it's like a very smooth surgery. Once the surgery is done, you may have to be in the hospital for a few hours. Once you're comfortable, we start with oral sips. If you're comfortable with that, also we give you liquid diet and then soft diet. You're able to pass motions, pass urine, we send you home. So post discharge, we give you certain painkillers and antibiotics so that you are comfortable. There are usually what we put as a waterproof dressing so that you can take bath right from the same day. So it's not like you have to take a bed rest or you have to not bath for 5 days, 7 days till we remove the stitch and all. You can take proper baths. You can do your normal routines from the next day onwards. So once after 7 or 10 days, we remove the stitches, and then yes, we can plan your next fertility action. So each and every procedure does have some risks. So what are the risks that are involved? So even if you are opting for a cataract surgery or maybe a nose surgery or a ear surgery or maybe an appendix for that matter, each and every procedure, each and every surgery has or may have some complications. So in this also, yes, there are few possible complications, but if done in proper hand, comfortable expertise, then in that case, the chances of complications are really, really less. So see, basically, it's not only the uterus or the tubes inside your abdominal cavity. There are intestine, there is bladder inside, there are multiple blood vessels that are inside. So in case while creating that opening inside the abdomen, in case if your intestines are adherent, that are to the abdominal wall, they might get affected. They might get trauma to it. So yes, trauma is a bigger complication. Second, in case if it ruptures one of the blood vessels, so there might be some bleeding and you may need some blood transfusion. Third is, as I mentioned, it is an anesthetic procedure. We give you anesthesia. So anesthesia also has a set of complications that might be expected. And fourth is, yes, though we have only two small cuts, 5 millimeter cuts over your abdomen, they might still get infected. So yes, we are going to take all the precautions prior only so that you don't face any complication. But yes, there is a possibility that you might have an infection at the port site. So what are the advantages of it? So basically, as I mentioned, it is a gold standard for evaluation of your reproductive system from inside and outside. So it is going to give me a precise visualization of the complete anatomy. So in case if there is some smaller blocks or smaller problems which may not be diagnosed on an ultrasound, 3D, 4D ultrasound or a HSG, SSG, those will be diagnosed with this particular procedure. So it is going to give me a better visualization, a better correction, because see, it is not only going to diagnose that particular thing. So in case if I have some endometriotic spots here and there, or if there are some adhesions, I'm going to repair it there and there. So it is a diagnostic come therapeutic procedure done in a same sitting. So that is the biggest advantage. Second, I can plan a action for you. Yeah, maybe if your OI cycle is not working, if your tube is blocked, or if it's like a grade 3, grade 4 endometriosis, it may come as a surprise to me. So I can at least give you a plan of action. Ki, ha, maybe this is not going to work for you. If both of your tubes are blocked, completely lost the ability to function well, maybe I'll tell you, ki, ha, maybe your natural planning or an IUI is not going to work for you. You need an IVF. So maybe I can give you that idea. Yes, this is a reason, and you need an IVF. So that plan of action is really really important for us, and definitely it is going to improve the success rate overall in conceiving. So in case if there is some smaller blocks that are seen in that fallopian tubes, we are going to remove it, and that is going to improve our success rate in overall. There are many patients who ask me, doctor, कोई alternative नहीं है? We do not want to undergo a surgery. Yes, we have alternatives, especially if you are if you're just checking for the tubes, if you want to check your tubes whether they are patent or not. There is an HSG option available, SSG option is available, but these are all diagnostic modality and they come with a set of other complications. But yes, we have alternatives, especially if you just want to check for the uterine factor. We can do a 3D 4D ultrasound, a beautiful image. We can make things really appreciable in that image also. So with that, I would suggest, but you cannot replace hysterolaparoscopy with other imaging modalities because that is a gold standard. So with that, I would conclude my talk. I would just give you a bottom line. Yes, it's a surgery. If given a choice, even I wouldn't want to undergo a surgery. But yes, if it is needed, it is needed. As we all know, no pain, no gain. So that thing works here as well. And one more important thing, in case if you have made up your mind that you want to go ahead with the laparoscopy, you want to get yourself evaluated on, please do it from a good laparoscopic surgeon who is going to respect your tissues. See, your uterus, tubes, ovaries are very delicate. And as a fertility consultant, we have seen a lot of washed up cases where managing later on after the surgery is very, very difficult. So I would suggest go to a good laparoscopic surgeon who is going to respect that tissue. With that, I'm wishing you very all the very best and hoping to see you next in the next session. Thank you so much. Any questions from your end are most welcome. Okay, I think there are no questions as of now. But in case if you want to get connected with me, I am always available at Apollo Fertility Thane, and wishing you all the very best. Thank you so much.